Good morning, everyone. I hope everyone had a fantastic weekend. I know it is Monday morning. I'm going to give it just a couple of minutes as folks are getting in out of the waiting room. We still see the numbers climbing, so once numbers slow down a little bit, I will go ahead and get started. Can everyone see this presentation okay? Great. Right. Looks like the numbers have slowed down a little bit. So for the sake of everybody's time, I'm going to go ahead and get started. This is the Providing Access and Transforming Health, or PATH, Capacity and Infrastructure Transition, Expansion, and Development, known as CITED, Round 4, How to Make Your Grant Application Stronger, Part 2. So there was a Part 1 of this webinar where we focused on the key narrative pieces, the organizational information of the application. That recording and those slides are available on the ca-path.com/cited website in the reference materials section. Highly recommend, if you were not able to participate in Part 1, that you do go back and review some of those, as these presentations do build on each other. We will provide some of the same background information at the beginning of this, so apologies for those of you that did participate. It will be some of the same information that you've already seen, but later we will do a deeper dive into the budget. You will be able to receive some new information. So there's also an informational session that was recorded, and the slides are available in that same reference materials section. So please check those out. We also have our guidance document and some other resources that we'll share a little bit later. So the overview for today, we're going to do introductions. We're going to talk a little bit about the PATH initiative as a whole. We'll talk about the cited funding opportunity, go over the application and some tips. Again, we did a little bit deeper dive into that in Part 1 of this series. We're going to talk about funding request guidelines, so how to complete that budget piece, and then talk through what are the next steps. So we have here on the call, I am Katie Thomas. I am the Cited Initiative Lead with Public Consulting Group, PCG. We are the third-party administrator of the PATH initiative on behalf of the Department of Healthcare Services, MCQMD, the Managed Care Quality and Monitoring Division. There are a couple of names on this slide, but quite a few DHCS folks here that are joining us. I'm also joined by Shannon Weaver, another Cited Initiative Lead, and Oliver Dibb, our Grant Review Team Lead. PCG, acting as a third-party administrator, is responsible for designing, reviewing applications, and the funding requests associated with those applications. We also maintain that public-facing documentation, so guidance documents, webinars, slides, all of those things. We're also responsible for the progress reporting process. So we follow you from the beginning of your application period all the way through completion of your project. We are also the fiscal administrator, and we help you troubleshoot any application issues, anything that comes up, as well as reporting on best practices and how cited funds are being utilized. Some of the goals for today are to understand the cited Round 4 funding request Excel workbook. That is a mouthful, but that is our funding request workbook. It is what all applicants will use when submitting their budget request in the Round 4 application. We will also talk about different guardrails that are associated with different allowable uses for the application. We'll also learn some best practices and strategies for developing that cited budget request. So really understanding what we're looking for as the TPA when we're looking through your budget request. I'm going to do a really quick high-level overview of the PATH initiative. So it is a $1.85 billion investment in capacity building projects for enhanced care management and community support services. There's also a justice involved reentry component that is a separate work stream. We are working with DHCS to administer these funds to build that capacity in the community. So today we're going to focus on cited. So I'm not going to go too much in depth on this slide for each of the initiatives, but under the PATH umbrella, there are 4 different initiatives. The cited initiative is a grant program that has been awarded over 3 rounds so far. This is the 4th and final round of funding that we're going to be discussing today. It is open. It has been open since January 7th, and it will close on May 2nd. So some of you who have attended previous webinars may be aware that the original closing date was March 7th. I am confirming that this has been extended to May 2nd. So the new closing date is a little bit longer. There may be some materials on our website that still say March 7th, but we are working through updating those, and you can utilize this webinar, these slides as confirmation, as well as there's an updated banner on the website as confirmation that the application closing date has been extended. We also have our collaborative planning and implementation initiative, which are collaborative planning and implementation groups that promote readiness for ECM and community supports. You are welcome and encouraged to participate in the regional collaborative in your area. Registration is ongoing and you can join at any time. We also have our technical assistance marketplace. We will call it TA marketplace or TAM. It is technical assistance for on-the-ground providers, community-based organizations, counties, hospitals, tribes to provide planning or technical assistance support for ECM and community support services. We also have our Justice Involved Capacity Building project. So that is funding to support collaborative planning and infrastructure and capacity for pre-release enrollment and suspension processes of Medi-Cal, as well as implementing pre-release reentry services. Round 1 and round 2 of JI are closed, but round 3 is open to targeted agencies. So if you are interested and think you may be eligible for PATH JI, then you feel free to reach out to the TA inbox and we can route you to the right partners to confirm your eligibility. All right, and with this, I will turn it over to my colleague, Shannon.
Thank you, Katie. So we're going to talk through at a high level the cited funding opportunity. We can go to the next slide. Katie touched on this, but as Katie mentioned, this is the 4th round of cited, which is a grant program enabling the capacity building, expansion, and development of ECM and community supports services for providers. Rounds 1 through 3 have already taken place, and those awardees are in the implementation phases of their projects. And as Katie mentioned, round 4 is the final round of cited funding that is going to be available and will be open until May 2nd. And all applicants who are interested in consideration for funding do need to apply and submit their funding request and complete application in our grant portal for consideration under this round of funding. A couple of things to flag for round 4. One key change in round 4 compared to other previous rounds of cited funding is the 1-year timeline for the performance period. All awardees will be capped at that 1-year project timeframe as compared to previous rounds of cited, which have typically been 2 years. So we do really encourage folks to take that into consideration as they're applying. There is not a limit or cap specifically for amounts that can be requested, but we do really want folks to consider what is a feasible amount and what activities in your budget can be requested that your organization will be successful if awarded in using all of those funds and meeting the objectives of the grant. For reference, the average amount that has been awarded in previous rounds for 2-year projects is about 1.1 million. And so, while there isn't a specific cap for this, for what can be requested in this round, we do want folks to be very thoughtful when they're putting together their budget about the amount that they can absorb and, hit the ground running on implementation to maximize all of their funds. So quickly, we'll share the priorities. These have been shared in previous webinars, and you can get more information about this in the Round 4 guidance document on our website. But at a high level, DHCS is considering a number of sources to inform the Round 4 priorities, which continue to be aimed at filling gaps in service provision and capacity across the state. So, especially looking at those county-specific gaps that may be in place for ECM or community support services. Statewide, looking at new ECM populations of focus or new community supports. So birth equity and justice involved populations of focus on the ECM side, and transitional rent on the community support side. Tribal and Indian healthcare partners are also continuing to be a priority for funding in this round. Rural counties and folks operating in counties where funding requests and awards have been lower across prior rounds, as well as organizations serving individuals whose primary language is not English, local CBOs, and counties who are providing transitional rent or looking to provide transitional rent. Okay, so we've talked through some of this in more detail in prior webinars, but quickly as a refresher, all applicants should navigate to the CA-PATH CITED website, and at the very top there is a banner and a big apply here, apply now button. So that is how you will access the grant portal and the application. And we'll continue to remind folks this is the final round, so if you're considering applying, please get in there early and be sure you're aware of where to locate that, how to navigate through the portal, type of thing. Okay, these are some of the points that we want to drive home to folks, really considering that 1-year implementation timeline. There are a number of steps that can be taken, internally and externally to set organizations up for success should they be awarded. Really socializing the proposed plans, making sure that key internal staff leaders are prepared and bought in, that the resources are in place, and also working externally with key partners to make sure that the project is aligned with the gaps and needs that may be in place. We also know that a lot of our requests do come in the form of staff salary and positions. So, think thoughtfully about the number of FTEs that you can realistically hire and onboard in that 1-year time frame. If there are approvals that are needed, either internally from a board or governing body for your organization, or externally permits or things that are needed in your community, consider those as well as you're preparing your application and your budget. And we know that in terms of eligibility, all applicants do need to be either contracted or have a letter of intent, an attestation letter signed by the MCP showing that you'll be contracted with an MCP to provide these services. If you have not already had those conversations, working with your MCPs to get those letters, to get addendums to existing contracts to cover the services that you're requesting funding for via Cited. And also getting quotes from vendors, making sure that they're aware of the time frame that you'd be looking at for implementation. A couple of logistical tips when you're submitting and filling out your application in Grants Connect or Grant Portal. There are a number of required fields. Those will be indicated with a red asterisk. You can, the portal does save your application as you're working, but if you do try to submit your final application and you've left any of those blank, it will give you errors and will indicate where you need to go back and fill out required information. Another important thing is to make sure that you have included all of the required documentation. Most critically, that is going to be the contracting documentation or any letters of attestation from MCPs, and then your budget template, which is what we're going to dive into later in the presentation. So we'll do a deep dive on that. Those are the two critical pieces that you'll need to make sure are included when you submit the application. And then lastly, make sure that you have all relevant contact information in your application and in your grant managers kind of section of the portal. We know that folks may be out unexpectedly, or there may be turnover. So make sure that you have a few points of contact in there and that email notifications are enabled so that your organization is aware if we do need to contact you for additional information or if there are any time-sensitive communications that are sent to you. Right, and then next section is just highlighting these are the sections that you can that you'll expect in your application. We covered most of the kind of narrative and demographic information in part 1 of this webinar series, and today what we're really going to focus on is the funding request, as well as touching on the final attestations you'll do right before you submit your application. So getting into the funding request, these are all of the allowable uses of cited funding. So funding can be used to support staff, either directly through salary support or via training or recruitment expenses. I do want to note that salary support should be captured on the staff salaries tab of the funding request workbook, and other expenses that may be related to staffing but are not directly for salary should be captured on the other tab of the workbook, which is labeled other goods and services. So if you have things like training, recruitment expenses, those types of things, those would go on the other goods and services tabs. And then your staff salary should all go on that staff salaries tab of the workbook. There are also allowable uses for costs related to IT, data, referral, and reporting infrastructure if your organization needs to expand their capacity in those areas to be able to provide these services. Folks also can ask for costs related to identifying gaps and needs, developing their strategy for filling those gaps and needs, and rolling out those new ECM and community supports services in their area. And then there are also allowable uses for conducting outreach to potential Medi-Cal members who are eligible to try to engage them in ECM and community supports services. Okay, so completing the funding request workbook, you'll start by downloading the funding request workbook. It's linked in these slides, which will be posted later. It's also available on the references section of our website. And then your organization will complete all of the sections thoroughly. Make sure to provide clear and detailed information on all of your funding request budget items that you would be using if you're awarded for cited funds in this round. And then in Grants Connect, you will upload that completed workbook when you're ready to submit under the document upload box on the funding request section of the application. It's really important that you include this. If you do not include this, if you do not use the funding request workbook template, your request may not be accepted, and the application may be considered incomplete, and our team would not be able to review it. So very important to use this workbook to fill it out in its entirety and make it really clear what your organization is asking for and how that supports the goals of CITED to expand ECM and community support services. And with that, I will go ahead and pass it to Oliver to do a little bit of a deeper dive into this funding request workbook.
Great. Thank you, Shannon. So as Shannon said, I'm going to dive a little bit deeper into the funding request workbook. I highly recommend if you are able, you can pull up the workbook from our website and kind of follow along as I'm going through that. So the workbook is going to have 4 different sheets or tabs. The first one's going to be in the instructions. So this is really important that you read through those. It's going to give you both some, instructions, but it's also going to give you some helpful hints. There's a lot of information on that tab, so I recommend you really read through that well. Then you're going to have the staff salaries tab. You'll have the third one will be other goods and services, basically anything that isn't your staff salaries. And then the fourth and last tab is going to be the summary. And so we're going to go through each of the salary, other goods and services and summary tabs and give you some more info and, some helpful tips for completing each of those thoroughly. So the first tab, the staff salaries, is going to have columns A through L. So you're going to have for each salary you're requesting, so for each position, you're going to need to give the allowable use, whether it's an existing staff or a new hire, the position title, description and justification of that position, the number of FTEs, the annual salary for the position, your fringe rate, and then H and I will calculate automatically. So it will calculate the total fringe cost based on your rate in G and the annual salary in F. In column I, we'll put those together. J, then you'll enter the number of months requested. Remember, I know this was mentioned, but it is a big change from previous rounds. There is only up to 12 months of funding available for round 4. So you can request up to the 12 months for that position in J. And then column K will automatically calculate your total requested based on what you enter for the FTEs, your annual salary, the fringe rate, and the number of months. So it's really important that you're accurate with each of those columns because it's going to automatically calculate your total for you based on what you put in E, F, G, and J. And then column L is just for you to select if it is retroactive. And we're going to go over a little bit more of what retroactive includes later on. If it is not retroactive, you just leave it as NA and that is automatically populated for you. So just some kind of tips for as you're filling out the staff salaries. When you enter in your column C for the position title, really make sure that title is clear. So some examples we have are ECM lead care manager, IT analyst. We really don't want you to use like a specific person's name. So if it's an existing staff, you already know who it is. We want their position title, not their name. And really this helps us, gives us a little bit more information on what that position is and does. And that helps, along with your description, tell the reviewer what that role is and make sure that the reviewer can understand how it meets cited guidelines. So in addition to a really clear title for the position, when you enter in your description and justification in column D, you really want to make sure to provide details of the position and roles and responsibilities, as well as a clear justification for the expenses. And a big part of this justification is, how is it meeting the broad goals of cited? So enhancing, implementing or enhancing ECM and or community supports. And then the other part is how does that tie to your overall goals of your project? So remember in part 1, when we were discussing the narrative questions, big part of answering the narrative question about your goals was tying it into the budget. You can kind of do the same thing here. A big part of this justification for your salaries is tying it back to those goals. So how is that lead care manager going to help you achieve the goals that you described? And then make sure you include the number of staff and the percentage of time you expect them to provide ECM and or community supports described in your application. And so just as a reminder, if only 75% of their time is going to be for ECM, then you can only request 75% of their salary, so 0.75 FTE. And then you can use some of our sample round 4 funding request workbooks that we've posted on the website to give you some examples of strong descriptions and justifications for different salary requests. Some other tips when you're entering the annual salary. So this is going to be column F. So, say 80K a year or, 65,909.22 per year. You want to enter that full annual salary, even if you aren't requesting a full year, even if you're not requesting a full FTE. That's because that column K, where I said, it calculates that total request for you, it automatically includes a calculation for the number of months. It automatically takes into consideration the FTE. So even if you're only requesting, 0.2 of an FTE for your, executive director, and you're only, requesting 6 months of that salary, you'd still put in the annual salary for that position in column F. FTE percentage, the fringe rate, the number of months, those are all automatically used to calculate the total. Big problem and error we see is people will put, well, I'm requesting 6 months, so I'm going to put 40K in the annual salary instead of 80. And then when you put 6 months in the month column, now you're actually only requesting 20K. And people are like, well, why did I only get 20K for this? And that's because we assumed the annual salary was half of what it should have been. Additionally, when you're putting for the staff salary tab, only include employee salaries. So full-time or part-time W-2 employees, independent contractors, subcontracted W-2 employees on this sheet. If you're requesting funding for other individuals, say consultants, third-party contractors, etc., you'll put their information on the other goods and services sheet. A good hint I have for this is if you provide them a paycheck through your payroll, it's going to be most likely a staff salary you'll want to put on this page. If you're paying them through an invoice, So say a consultant is billing you for 100 hours of their time, they provide you an invoice for that. That's going to go on the other goods and services page. And then don't leave any cell blank. As I said, the total calculates automatically. If you don't put a number in a cell, you're going to get errors in the total. And then double check your numbers. Make sure that when you look at your totals, it makes sense to you. Our reviewers really can only review what is in that workbook. So we may not catch if you, have numerical errors that could affect your potential award. Right. So that's for those were for the staff salary tab. The next tab is your other goods and services. So you're going to have a lot of similar information. So from your staff, as for the staff salaries, you'll have your allowable uses. Then column B is going to be a description of your item or activity. Then you'll give, or the name of your item or activity. C will be the description and justification. D is the number of units. Then the cost per item per activity. Column F, the total amount requested, and G, retroactive funding. Right. So just some tips for your other goods and services. Much like your description and justification for your salaries, you should also make sure that you provide a detailed description of the item or activity, a clear justification of the expenses, and how the request supports the overall goals of your project. Tie it back to your goals that you provided in the narrative. Again, we have 3 sample funding request workbooks on the website. Look at all of them. They'll provide you some different examples of items that people may request and provide you examples of those strong descriptions and justifications. And don't leave anything blank. Column F, the total amount requested. Again, it's calculated automatically. It takes the number of units and the cost per unit for that activity to get you your total. So it's really important that you don't leave anything blank and that you're double checking your numbers and that they make sense. Again, we really can only review what is there. So if there's numerical errors, that could affect your potential award amount. Right. Additionally, if you're requesting something for a certain number of months, make sure to include that in your description. So we have an example here about an EHR, electronic health system, and you can see they clearly provide, what they're requesting, why they need it, and then how many months and the cost per month. So that you see, 18 months, although I do call out that 12 months is the total maximum for round 4. You see how much per month, and you see how much is going to be used by ECM and Community Supports. So that's a really strong description and justification for that item. Some other ones that you may see that are, we really need to know the months would be anything that is a subscription or something like rent to support ECM and Community Supports. Another really helpful tip is if you have more than one item within a line, make sure in that description and justification, you provide a clear breakdown for each item requested. So an example of, an item or activity that people have done is, staff IT equipment for new hires. So in column B, where they say, item or activity, it's staff IT equipment. And then in the column C, where you have the description and justification, if you are hiring 10 new staff, we need to know, how many of each and what is that IT equipment. So we can't just provide you funds for generic IT equipment. We need to know how many, what it is, and what the cost per each item within that is. So you can see that the example clearly breaks down. There's 10 new staff, and for each of those new staff, you're buying, one laptop, and the cost of that laptop is $1,500. And then it kind of gives you the explanation of that total. So that makes it really clear to reviewers what you're requesting, for how much, and it's very easy for them to understand how it meets cited guidelines. The last tab in your funding request workbook is going to be your summary. Now, there is nothing you will enter or change on this. All of these fields on this summary tab are automatically calculated from the staff salaries and your other goods and services tab, including the 5% indirect rate. This is a new change for round 4. All applicants will automatically have the 5% indirect rate added to their total request, and that is done automatically. So you should not include 5% indirect anywhere on the staff salaries or other goods and services tab. It is automatically added here. And then you will, it will give you the total amount of your request. This is the number that you're going to copy and put into your funding request tab of your application in Grants Connect. So you can see the screenshot there where you're going to take that exact number under the total request amount, cell B5, and copy and paste that exactly into your Grants Connect application. It's extremely important that you make sure these two numbers match. If they don't match, reviewers are not going to be aren't going to be able to clearly understand how much you are requesting. Okay. So I touched on the indirect piece of this a little bit. Again, it's going to automatically be added to your total request in the summary. You don't need to include it as a separate line item in either of the staff salary tabs or the other goods and services tab. But just kind of as a reminder of what indirect costs are. So these include administrative overhead expenses not identified within the funding request, but necessary for the general operation of activities. Some of the things that could fall into indirect for cited requests include, but are not limited to, travel, training required for your staff, but not specific to ECM and or community supports. So obviously there may be training required by your organization, but it's not specific to ECM or community supports. That would fall here. Goods and services, mail services, payroll, procurement, legal, advertising, communication costs, and other ongoing operation and maintenance costs for supplies and facilities. So I know we talked about, how to fill out the staff salary tab in the funding request workbook, but we wanted to pull and provide some other guidelines for staff salaries. So these are really going to be really important as you're determining what you're going to request in terms of salary support, if you're going to request salary support. You can find these in guidelines also in our guidance document on the website. But we want to really highlight that cited funding, can be used for administrative or service-related positions necessary to support ECM and or community supports. And that, again, there's salary requests can be for no more than 12 months across all salary round or all cited rounds. So in addition to there being a 12-month, cap for this round, if you're requesting salary for a position that you've already funded through cited, that can be no more than 12 months across all cited rounds. So if you've already received 12 months of funding for that position, then it is not allowable to request more in this round. If you have funded, say, 6 months and you're requesting an additional 6 months for new duties related to ECM or community supports, that would be allowable. But it's really important that you provide a really clear description and justification if that is what you're doing in that funding request workbook. And additionally, you can only request the portion of the FT that's directly related to supporting the delivery or administration of ECM and community supports. So if you are requesting, salary support for an HR position to support the, onboarding of your new hires. If their sole duties are not just ECM and community supports, if you provide other services at your organization, as many do, you can only request the portion of their time that's going to be, related to supporting the delivery or administration of ECM or community supports. And then in just another helpful hint, we really do look at the salaries being requested and want to make sure that they're reasonable for the position and for, the area that they're in. So we really recommend that you look at general salary ranges that can be found on some of the websites listed. We define reasonable salary ranges as no more than 80 to 90% of the top of the salary range. So if it goes from, 50 to 80K, then it would be, a reasonable would be between 80 and 90% of that top 80K number. So, we also highlight that for direct service roles. So these are things that are roles that directly provide ECM and or community supports. So some examples are housing navigators, care managers, any other roles that can bill the majority of their time to Medi-Cal for ECM and or community supports. Cited funding may only be used to support staff salaries where at least 60% of the FT is directly related to supporting delivery of ECM and community supports. So if their direct service role, at least 60% of their time must be for ECM and or community supports, and Cited has to fund at least 60% or 0.6 of an FTE for those roles. For roles that are non-direct service, so your management, IT, admin roles, there's no minimum FTE requirement, so they are not subject to that 0.6 FTE or 60% minimum. However, these requests still need to be reasonable and relative to salaries for similar positions in the region. And one caveat we put on that is executive positions. So CEO, COO, CFO, executive director. These positions are limited to 20% or 0.2 FTE due to the scope of these positions. And again, we have that guidance document linked there to provide additional guardrails for staff salaries. Right. So retroactive, you have the option to note for each line item in the funding request workbook if it is retroactive. Retroactive request must be for activities completed between January 1st, 2022 until the release of applications for the cited round of funding you're applying for. For this, that is January 5th, 2025. These retroactive funding requests must still be aligned with cited goals and only contain allowable items or activities. They are limited to a 12-month period. And again, on page 13 of that cited guidance document, you can read more about retroactive funding guardrails. Right. So that was kind of our, helpful hints on salaries. We also want to provide some helpful guidelines and hints for and tips for IT requests. So a lot of what people request through Cited are IT related items related to modifying, purchasing, and or developing the necessary referral, billing, data reporting, and other IT infrastructure and systems in order to support integration into CalAIM. So because this is, a big allowable use category, we want to really highlight that only the percentage of the IT system or software that can be dedicated to the use for ECM and or community supports can be funded. So if you're requesting funding for an EHR, but you're, half of your EHR is going to be used for, other medical billing, and only half that's going to be used for ECM and or community supports, you can only request funding for, 50% of that cost. We also want to highlight that you must be able to demonstrate that you've collaborated and communicated with your MCPs in order to support the data and infrastructure needs. So, any applicants who are requesting funding for data infrastructure must demonstrate this collaboration and alignment with NCP system requirements in order to fully participate with the CalAIM initiatives such as ECM and Community Supports. So we really want to make sure that the IT infrastructure you're requesting to be funded through CITED meets what your MCP requires it to. We don't want to fund things that don't actually meet MCP requirements. Okay, so we've pulled out here, I'm not going to go through each of them, but as you're kind of trying to find some examples of what might be allowable IT requests, these are some of the IT requests that have been approved in previous CITED rounds. So things like HIE systems, EHRs, EMRs, case management software, etc. This list is not exhaustive. These are just some examples. It is subject to change at DHCS discretion, and any of your requests, even if they fall within these types of items, still must meet all other CITED requirements. Then we have some unallowable IT requests. So again, this list is not exhaustive. It is subject to change at DHCS discretion. And again, any of your requests must meet all other CITED requirements. But a lot of these are things that are more generic IT requests that are not necessarily specific to providing ECM or community supports, or are not really a necessary, startup cost, but maybe more considered one of those ongoing, costs that should be covered potentially under your indirect. And so some of those, emails, Zoom accounts, Adobe, Tableau, SurveyMonkey are just some of the examples of unallowable IT requests. Okay. So now we want to highlight some guidelines and helpful tips for training requests. So another allowable use for CITED funds that a lot of applicants request is support for training. So really want to highlight, as with all activities or items requested through CITED, they do need to be specific to ECM and or community supports. Oftentimes we'll see, general training like HR required training being requested, and that is not allowable, although we do highlight this could be covered through your indirect costs. And requests for training are capped at $4,000 per new staff and can include any combination of allowable training. And we do just want to, highlight that the Technical Assistant Marketplace, our TA Marketplace, has a lot of trainings that are available through that funding source. And so we really highly recommend, if you're looking for training support, that you visit the link there to our TA Marketplace. Right. Like with the IT systems, we provided some examples of some allowable training requests from previous awardees. Again, this is not exhaustive and is subject to change. Just a few are, trainings on your new EHR systems, and training on, billing and data systems for ECM and community supports, case management training, etc. Won't go through all of them, but those are just some examples we have from previous awardees. Some examples of unallowable training requests that's not exhaustive and subject to change includes some of those more generic things. Things are not specific to ECM and community supports. We have, project management, Microsoft Office skills, certified alcohol and drug counselor certifications, time management, organizational skills, etc. We also wanted to highlight some guidelines around mileage and vehicles. Now note that our guidelines on mileage have been updated for this round. Mileage reimbursement for round 4 is at the U.S. General Services admin rate for staff traveling to provide in-person ECM and community supports, and that is allowable. Mileage reimbursement or travel expenses for attending training events or conferences are not allowable. Mileage reimbursement for transportation of any members is also not allowable. So if a staff is going to meet a person in the community, mileage reimbursement for that is allowable. If they're, taking a member somewhere, that would not be allowable. Vehicle guidelines. So vehicle purchases are allowable if they are purchased outright solely for ECM and or community supports. You should provide the price, vehicle type, and number of vehicle requested in your funding request workbook and ensure that those are reasonable for the area and services provided. Right. We have then translation services. Guidelines for translation services are for cited are that, translation services are a covered Medi-Cal benefit. And so these are cannot be covered with cited funding. What you can use cited funding for would be to translate educational outreach or marketing materials specific to ECM and community supports. So we can cover the translation costs for that. However, we do note, and we'll get into some of our unallowable uses on this in a moment, but cited does not cover the printing of these outreach materials. Additionally, in-person translation interpretation services during staff training events are not allowable under cited. Right. I'm not going to go through each of these individually. Again, this will be posted on our website for you, and we'll go through those resources at the end. But we do have some reasonableness guidelines for some frequently requested items. For laptops, 1,500 is kind of our reasonableness cap. Things like vehicles really should be specific to what type of vehicle you need and kind of what the average is for that. But we've provided some examples of reasonable and unreasonable requests for some commonly requested items. All right. And I'm not going to go through each and every one of these, but I'm going to highlight some of our unallowable uses. Again, this is in our guidance document. I really recommend that you read through this carefully, familiarize yourself with it. If you do request anything in your budget that is unallowable and on this list, we will not be able to fund that request if you're funded through cited. Some of the things that are unallowable are services otherwise covered through Medi-Cal. So just like the translation services, which are a Medi-Cal benefit, we cannot fund any services that are otherwise covered through Medi-Cal. Fuel or maintenance for transport vehicles, direct CalAIM services, funding to cover ongoing financial losses, any non-ECM or community supports time for staff, donations, entertainment. Highlight that this includes like conferences, receptions, parties, or food. Any fines and penalties, and any costs of organized fundraising are unallowable. And then we have the unallowable use continued. So we cannot fund any goods or services for personal use. This includes for staff or clients. So one thing that we see often requested that's unallowable would be any sort of like kits for staff or clients, hygiene kits, or things like that are given away, gift cards, staff uniforms. We don't pay for marketing material costs, clinical health screenings, bank and payroll fees, employee background and drug tests, etc. Again, this is all in our guidance documents. So I really recommend everyone really read through that and have that, readily available as you're filling out your funding request workbook. So that is all of our information on the funding request tab of your application in Grants Connect. Once you've gone through, uploaded your funding request workbook, entered in your funding amount, and answered the other questions on that page. The last page in the application in Grants Connect is your attestation and certifications tab. And so this tab really is just, where you sign that everything you've submitted is accurate and true to your best knowledge. Applicants must have an authorized representative of their organization review and electronically sign the application for submission. Any applications that are not submitted through Grants Connect by the deadline will not be reviewed. And we note that they have to be submitted through Grants Connect. So applications that are emailed to the cited inbox will not be accepted. And we really strongly suggest that you submit your application a few days prior to the deadline to ensure that if there are any technical issues, these can be addressed prior to that deadline. And with that, I'll pass it over to Katie.
Thanks, Oliver. That was all really helpful. I'm sure all of the information is non-exhaustive. There is a really detailed, thorough guidance document out there, as well as previous webinar recordings. So please make sure you take advantage of those. I want to really briefly, in our last 3 minutes together, cover some next steps and provide some resources to you all. So again, make sure you apply for funding at ca-path.com/cited. There is that blue apply button at the top that will then prompt you to either create an account with Grants Connect or sign in to your old Grants Connect account if you have applied for a previous round. Your profile remains the same, so you can utilize that previous login. I'm going to repeat again, as we've had people joining and dropping, that the round 4 application window has been extended. So originally, the application was set to close in early March. However, the new application closing date is May 2nd. So you will see some of those reference materials and things being updated over the next couple of weeks with the new closing date. There have been some communications that have gone out already that say the new date on them, as well as our website has been updated. So if you all who are working on the application need to go back to your leadership teams, your board, and say, hey, we have some additional time and you need some sort of proof to show them that, our website is up to date. However, I will say the guidance document and a couple of other things are still being updated. So please use the website as the most up-to-date source of information for that. This is the last webinar in our series. As I mentioned at the top, we do have recordings and postings of the slides from our informational session, our How to Improve Your Grant Application Part 1. And these slides and recording will also be coming on the website in a couple of days. In addition to these webinars, we also have some upcoming office hours. So that is a place where you can come and ask questions. It is, even if you don't have any questions about your application, we have heard that folks really learn from each other in these sessions. Some of the questions that folks are asking may, be a question that you haven't even thought of yet. So those dates and registration links are currently on our website. If you registered for some sessions prior to the application closing extension, you may have noticed that those dates and times have changed. We did have to make some adjustments to make sure that we were able to host office hours throughout the entire open application period. So check out those dates on our website. And then we also have some resources, our guidance documents, some gap filling plans, our CPI page, as well as something that is a new resource to you all that I highly suggest you check out is our Grants Connect frequently asked questions. So how to make an account, how to troubleshoot, how to add additional points of contact to your application. All of that can be found in our Grants Connect FAQ. So please check that out if you're having any trouble with your Grants Connect account. As Oliver mentioned, we also have some sample budgets that is also new to this round. There's a couple that are really, really helpful depending on the type of service that you plan to expand, implement. So check those out. There are 3 in the references materials section of the website. The funding request workbook, which as you learned in this webinar is very important to the success of your application. I will also note we have a PDF of the application also on our website. We don't accept submissions via PDF. That is truly so that you can, print it out, take it, look at it, talk to your partners about the application. It should be just used as a guide, as a sample. Like I mentioned, they can all be found on our PATH CITED webpage. You'll want to scroll all the way down to the bottom to the reference materials. I believe only 6 or 8 reference materials populate at first. Hit view more. You may have to hit view more twice because there are a lot of resources available down there. Pointing out our cited at ca-path.com inbox. We do respond to inquiries within 48 to 72 hours. So we will be monitoring that inbox throughout the entire open application period. We also have the 1115 path at dhcs.ca.gov inbox. That is the DHCS General PATH team inbox. However, we do urge if it is an application question, please reach out to the cited inbox. We also have a phone number here that is that you can call in and ask your question. And then again, I cannot stress it enough, our PATH CITED website is where you can find all of these really, really helpful materials. And I will stop there as I know we are 1 minute over the allotted time. Want to be respectful of our time. So please join our office hours, email the inbox to ask any questions, and be on the lookout over the next couple of days for this recording and these slides from this webinar. Thank you all, and I hope you all have a great day.